Adult braces are possible, as any other braces are, at any age. So children, really, we say, should be treated idealistically, whereas adults can be treated more realistically. So the two main reasons that adults, or probably the main reason that adults will consider orthodontic treatment, is to straighten their teeth, because they have crowding. And what tends to happen with adults, if there's a little bit of crowding, as we age, teeth tend to push forward. So the crowding will often get worse. So the main reason would be cosmetic crowding of the teeth. But it might be that your dentist recommends braces because there are also bite issues or other restorative reasons we might be doing braces before restorative dentistry. So generally for adult orthodontics, there are two types of braces. One is a removable type of aligner brace, and there are various brands around of that, and probably the best known brand is Invisalign. But Invisalign is a type of aligner, and there are other brands. Aligners work very well and very predictable, but it's important to realize that the aligners need to be worn 24/7, so full time, apart from taken out to eat and drink anything except water. So they work, they're very invisible, but maybe a little bit more impactful on the patient's life than the alternative, which is fixed braces. And fixed braces can be traditionally metal on the outside, but more and more we would use tooth-colored braces on the outside, or in fact can be on the inside of the teeth. And fixed braces also work very well, but from a patient's point of view, maybe not as invisible on the outside, certainly just as invisible on the inside, but are working all the time, and the patient doesn't have to take them in and out. So either aligners or fixed braces. So the main difference potentially in treating adults is that we may accept some compromises in the teeth position, whereas with children, we really want to treat them the most idealistically possible and give them the most ideal bite. So adults might accept the fact that their teeth are slightly further forward. We have an increased overjet. Whilst that can be corrected, if the patient's main concern is crowding, the crowding is going to be corrected a lot quicker than if we're correcting bite issues. So uncrowding the front teeth typically can happen in as little as 6 months. Whereas if we're trying to change the teeth relative to each other, particularly an increased overjet, that involves a lot more tooth movement. And so the treatment may progress to as much as 12 to 18 months. So it depends if we're just correcting crowding or if we're making more changes to the bite. Whereas if the two different names we might say is, if we're just uncrowding the teeth, we might call that cosmetic orthodontics, anterior tooth alignment, short-term orthodontics, not because the results are short-term, but because we're treating the patient in the short term. But the alternative is more comprehensive orthodontics, where we're trying to line the teeth up as well as, we're trying to improve the bite as well as just align the teeth. With any type of brace, it's very important that one monitors the sugar intake. So with aligners, you wouldn't eat with the braces with the aligners in place. So a little bit less risky from a point of view of decay. But with fixed braces, it's very important that the sugar intake is monitored, because one can get decay around the fixed braces. And even if it's not a decay, one can get demineralization, which is early decay, and that will tend to leave marks on the teeth. So cleaning is essential, and being mindful of sugar intake, as well as avoiding foods that are very, very hard, because the bond of the fixed braces to the teeth is very strong. But with certain inappropriate foods, it is possible that the brackets, the fixed braces, can come unstuck from the teeth. And whilst that's very easily dealt with, it does involve a visit to the dentist, an extra visit to the dentist or orthodontist. And so being mindful of foods that are too hard is beneficial. So the length of time for braces depends on what we're trying to achieve. If we're just trying to uncrowd the teeth, particularly the front teeth, and we're focusing on what some people call the social six, which is the front teeth, the treatment can be very rapid and as little as 4 to 6 months, because front teeth are single-rooted teeth, they untwist quite quickly, and so less treatment time. If we're trying to bodily move the teeth, particularly back teeth, or we're correcting overbites or frostbites, that will take longer, typically as long as 12 to 18 months.